Hello, I'm Mike Willis, Director of the Office of Emergency Management and Incident Commander for the COVID-19 incident. Thank you for taking time out of your day for this important message and this important process. As many of you know, Colorado applied for and received a major disaster declaration from the President on March 28, 2020. Frankly, that was the easy part. We are already getting lots of questions about how to apply, and we do not yet have all the answers. I've stood up the State Recovery Task Force, and it is in constant contact with FEMA. And as you can see behind me, they are here with us in the state's Emergency Operations Center. FEMA has been a great partner through this, and we continue to work with them closely. DHSCM's Office of Grants Management will be the lead agency in coordination with FEMA, and DHSCM will be the point of contact for FEMA. You cannot apply directly to FEMA. You must apply through DHSCM. And FEMA will have many limitations on eligibility, and some of you and some of your reimbursements will not all be eligible. However, you should apply anyway, as conditions and information will change through this dynamic incident. If we do this right and we work together, we'll get through it, and it'll be much easier to do it right up front rather than fix problems after the fact. That's why I've directed my staff to get information out as soon as possible, even if we don't have all the answers. Please be patient, and we will get information to you to help protect you and provide you and your communities the reimbursements they need. Thank you for doing the job you're doing, and on behalf of Governor Polis and Executive Director Hilke, please continue to work hard. We're all in this together. Be safe.
Hello, everyone. My name is Michael Haney. I am the State of Colorado State Public Assistance Officer. I work for the Department of Public Safety in the Division of Homeland Security and Emergency Management. This video is going to walk you through the initial steps of applying for the FEMA Public Assistance Program and also help you to understand some of the eligibility requirements and who should be applying and how to properly document your costs. This training is going to be recorded and will be available on YouTube. Please make sure that your relevant people in your organization do see this video, especially important for finance officials, emergency managers, or anyone else in your organization that might be responsible for tracking these costs that we're going to go over. This is the first time that FEMA Public Assistance has ever been used to respond to a pandemic event, and accordingly, things are just changing a lot as we go through this. However, FEMA is doing a very good job of updating their website on a continuous basis. The website is fema.gov/coronavirus. Alternatively, you can send questions directly to the state at the CDPS_DR4498 at state.co.us. So first, just a very high-level overview. FEMA Public Assistance is a program that is designed to help communities recover from major disasters and emergency events. Specifically for the COVID event, we have been authorized for what they call Category B work, or the life-saving emergency protective measures. And that's why I've highlighted it here on this slide. The eligible applicants, which we'll get into a little bit later, are local governments, states, tribes, territories, and certain private nonprofit organizations. FEMA Public Assistance is FEMA's largest grant program. And since 2017, FEMA's given out over $5 billion. So what we're going to be covering today is, first and foremost, we're going to be covering applicant eligibility. I want to cover that first just because I do think there's a lot of confusion about all of the different programs that Congress and the federal government have passed right now. I am just talking about FEMA Public Assistance today, and there is some very strict applicant eligibility requirements along with that. Next, I'll just go into a brief overview of public assistance and just kind of the process and how it works. Then we'll get into what type of work is going to be eligible and then what costs are eligible. To the right here on this slide, you will see what FEMA calls their pyramid of eligibility, and kind of how that pyramid works is you have to start at the bottom and work your way up. So that's why we're going to talk about applicant first. We don't really need to talk about facility just due to the nature of this, but the immediate threat, the work, and the cost, which we'll all cover on today's slides. All right, so the first thing I wanted to cover is applicant eligibility. So up on your screen right now, there is just kind of a list of the government entities that are eligible to apply for FEMA Public Assistance. So first and foremost, tribal governments are eligible to apply. Also local governments, and then there's a list of bullet points here that you definitely should take a look at. And if you check one of these boxes to be one of these types of local government entities, you are eligible to apply for FEMA public assistance. Later on in this, we will show you exactly how to apply for that, but right now just make sure that you fall into one of these categories, and if you do, you are eligible to apply for FEMA public assistance. The next type of organization that might be eligible to apply for public assistance are private nonprofit entities. So given that we have only been authorized for emergency protective measures, most private nonprofit organizations are not going to be eligible to apply for FEMA public assistance. So specifically, if you are a private nonprofit that provides either education, medical services, emergency services, or utility services, you may be eligible to apply. However, if you do not provide one of those four, what FEMA calls critical services, then you are not eligible to apply for FEMA public assistance. The other situation that has arisen in this event is that private nonprofit entities are performing emergency protective measures at the request of a local government, and that's what this first bullet point kind of discusses. So if you are a private nonprofit that's performing life-saving measures or measures that are protecting public health, and you're doing so at the request of a local government, those costs are most likely eligible. However, the eligible applicant is most likely going to be the local jurisdiction, which tasked you with that information. But like I said, most of the time, private nonprofits are not going to be eligible under this type of declaration. So if you are a private nonprofit and you have questions about your eligibility, please use that email address, the CDPS_DR4498, and we can help walk you through that. Other things to cover are just ineligible applicants. So businesses are just not eligible under the FEMA Public Assistance Program. The program that you're interested in is actually the Small Business Administration, and you can go to their website and check that out. Also, private nonprofits that do not provide medical, educational, emergency services, or utilities, you're just not eligible under this declaration. And I wanted to kind of get that out front so that you didn't listen to this entire briefing and find that out later. Also, individuals are not eligible under FEMA public assistance. So going back to government entities that can check one of these boxes here, or private nonprofits that are responsible for delivering education services, medical services, emergency services, or utilities. Finally, I did just kind of want to talk right off the bat about other federal funding sources. So right now, Congress has appropriated a lot of different funding for this incident. Most notably, Health and Human Services in the state has delivered $10 million worth of funding, which is being administered by the Department of Public Health and Environment, CDPHE. A lot of the same costs that are eligible for FEMA public assistance are also eligible under the HHS grants. The big difference between the two grant programs, to my knowledge right now, is that FEMA public assistance has a 75% federal share and a 25% non-federal share, whereas the HHS grants have a 100% federal share. So obviously the Health and Human Services has really no costs to the local governments. CDPHE and DHSEM are working to deconflict these costs. However, if you believe that you are eligible for the Health and Human Services grants, I definitely encourage you to reach out to CDPHE, because the last thing I want to do is lock you into a FEMA public assistance grant with a 75-25% cost share, 75% federal, 25% non-federal, when you could be eligible for a 100% federal share grant. Okay, the next thing that I wanted to cover is just kind of a brief overview of the process that we're going to go through with the COVID-19 incident. So the first step is what we're doing right now, which is the applicant briefing. After we do this applicant briefing and we just kind of give a brief overview of the process, the next step will be registering in FEMA's grants portal. So I'll show you how to do that real quick. So first thing you want to do is go to grantee.fema.gov. Once you go there, this page should pull up, and then you'll see this button just down here. This was just added this last weekend, where you can register your organization and request public assistance. If you click on that, it will, again, just kind of go over what we just went over of who the eligible applicants are. Nonprofit organizations, you do need to reach out to that email address, the CDPS_DR4498, to just see if it's kind of worth everyone's time for you to put in a request for public assistance. The other things that we covered here is individuals looking for individual assistance need to go to the disasterassistance.gov, and the businesses need to go to the Small Business Administration's website. Then you'll click here, I'm not a robot, and then it'll ask you to fill out some additional information. But again, that website is grantee.fema.gov, and you can register for access right there. The next step in the process is that you will submit your request for public assistance. My understanding is that FEMA will be putting out a specific RPA, which will ask specific questions for this incident. After that, your request for public assistance will hopefully be approved, and then it is up to you to upload documentation. Again, we're kind of going to be working outside of the normal rules and regulations for this event, so I do not have a list of documentation that will be required on the front end. We will go over the documentation that's required for closeout later on in these slides, but for right now, some lesser amount of documentation will be required at the beginning of this, and when that guidance becomes more clear, I will provide it to you. The next step is the CRC review. That is the Consolidated Resource Center review. So that will go to the CRC in Denton, Texas. So it's a bunch of people in Denton, Texas that review your work and write what we call a project worksheet for your project. After that, the state and FEMA will review it, and you will also have an opportunity to review your project worksheet before it becomes final. We'll all sign off on it and say, yep, here's an accurate picture of their costs to date and their estimated future costs. After that, the funds will be obligated. At that point, the state will draw up an agreement for you. That agreement will need to be executed before we can really start the next process, which is the reimbursement process. So that will be a process that you go through with the state of Colorado. It will be through our EM Grants Pro software. So some of you have already used this software. Some of you have not. Our goal is that while we're going through the CRC review process, if you're going to need to go through EM Grants, we will have additional trainings on how to go through EM Grants. The next thing is version requests, if those are necessary. Version requests are just, if the project worksheet doesn't have enough funding in it, or if you need to substantially change the work that you're doing, we can go through a version process. And then finally will be project closeout. So I'm going to go back and just kind of talk a little bit about some more of these steps. So again, during the uploading documentation and the CRC review process step, ideally we will be talking a lot about, okay, here's the documentation that you provided to get your PW obligated, and then here's the documentation that you're actually going to need for the reimbursement process. Through this time period, we really should be working to get as much documentation into our EM Grants Pro system as possible, because if we have really bad documentation that was put in and the CRC is obligated based on that documentation that doesn't give us what we need, and again, we'll go over that later, then your reimbursement process is going to take a long time. And I do not want to get into a situation where we're arguing back and forth over documentation requirements and everyone's getting frustrated because we can't pay the money and you need the money. But if we do not have good documentation, we've learned from the 2013 and the 2015 floods that trying to gather the documentation on project closeout is extremely difficult because time has passed. People have maybe left the organization and we just can't get that documentation anymore, which jeopardizes your reimbursement. So really, throughout this whole process, we're going to be working together to try and make sure that we have a really good package put together so that when we get to the reimbursement process, it's more just a process of the team here at DHSEM just saying, oh, yep, we already know what all these costs are. We already have good documentation in the EM grant system, and we're going to push it through. That's the dream. Whether we get there or not is really going to rely on our sense of teamwork throughout this process. The next topic I wanted to cover is how do you determine if the work that you're completing is eligible for FEMA public assistance? So for DR 4498, again, that is just the name of our disaster from the federal government, the only thing that has been approved right now is Category B, or Emergency Protective Measures. So eligible work for emergency protective measures includes the items listed here, such as management, control, and reduction of immediate threats to public health and safety, emergency medical care, medical sheltering, security and law enforcement, communications of general health and safety information to the public, and reimbursement of force account overtime costs. So force account is the name that FEMA uses for your own in-house labor. So your in-house labor overtime costs. And we will go over labor costs a little bit more detailed a little bit later because they can get a little bit complicated. I also wanted to just let everyone know that, again, that FEMA website that I referred to earlier, so fema.gov/coronavirus, has a lot of good information on this. So if you come here to the news releases and fact sheets, there's actually a tab right here that says eligible emergency protective measures. And if you click on that, it'll take you to a page which gives a little bit more detail than this. And this page is updated as new things become available. On the next slide, I wanted to talk a little bit about items that may be eligible for work. If it becomes necessary to shelter household pets as a result of if somebody is ordered to quarantine or isolation, not just home isolation, and something has to be done with their pets, those costs might be eligible. Additionally, if it becomes necessary for food, water, ice, medicine, or other consumable supplies to be distributed to entities or individuals in the state, that may be eligible as well. And then finally, non-congregate shelters might also be eligible. Generally speaking, under FEMA public assistance, FEMA will only fund what they call congregate shelters, which is, like if we put everyone into a large gym as a result of a tornado or something along those lines. However, the nature of this incident, that's not a good idea. And so FEMA has limited authorization of non-congregate shelters where some municipalities are, leasing out hotels, and then, symptomatic people are being told to isolate in those non-congregate shelters. If your jurisdiction is thinking of setting up a non-congregate shelter, it does require a case-by-case approval by the FEMA regional administrator. If you do want to set up a non-congregate shelter, please again email that CDPS_DR 4498 at state.co.us email address, and we can walk you through the steps of setting up a non-congregate shelter and making sure that it is eligible for FEMA reimbursement. The other things that we need to cover on work eligibility is, first and foremost, the work has to be the result of an immediate threat that results from the declared incident. So sometimes drawing that string all the way back to the declared incident is difficult. And if you have any questions about drawing that back to the immediate threat resulting from the declared incident, again, please just reach out and we'll see if it's eligible work. But the final thing I wanted to point out is that it must be the legal responsibility of the entity that is undertaking the work. So an example of this would be if the county at large decides to send food to a senior center or something along those lines. That may be an eligible cost as long as it is actually the legal responsibility of the county to do that. So I guess what I'm getting at here is it's one thing to do something because it's the nice and right thing to do. It's another thing to do it because you actually have the legal responsibility to do it. So FEMA is required to ask that question, and then they will ask for backup documentation, documenting that it was your legal responsibility to do those things. So they'll ask for, policies and procedures or a statute that says, yes, this actually was our legal responsibility to do. Again, I cannot stress that enough, that we really do need to establish legal responsibility. It is a question that does come up, and I do believe will come up quite a bit during this incident.
So the next thing that we're going to talk about is the cost eligibility, which is kind of the top of the pyramid of FEMA's eligibility pyramid that we showed earlier. First, we just want to go over some key points. So the first one is that all costs have to be directly tied to the event. So the event, obviously, in this case, is the COVID-19 pandemic, and all costs must be able to be tied directly back to that event, and specifically how those actions and these costs are related to protecting public health and lives. We'll go over that a little bit more later. The next one is that all costs have to be consistent with policies and procedures. So, first and foremost, it has to be consistent with your local procurement procedures. And if your local procurement procedures have been waived due to the emergency nature, then it still has to be compliant with federal procurement procedures. And again, we'll go over that a little bit later. Also, federal contracting requirements are still in place despite the emergency and exigent nature of these. And again, we'll go over kind of what that means a little bit later. And then finally, that all costs have to be reasonable. That's a key piece of all federal costs. But again, we'll go over that a little bit later. So to talk about cost eligibility, the other thing that is really important is that all costs to be eligible have to be properly documented. And I really cannot stress this point enough. The quality of the documentation that you are able to put together, today, yesterday, and into the future is going to determine the speed at which you get reimbursement. Providing all the documentation to FEMA and the state in an organized fashion, and it has everything in there, will result in a reimbursement process that will hopefully only take a few months. However, providing inadequate documentation or piecemeal documentation, most likely your reimbursement process will take years, and I am not exaggerating. We have seen that through our public assistance declarations in the past, and other states have seen this, as is evinced by the fact that, Hurricane Katrina from 2005 is still open and they're still gathering documentation to this day. I cannot emphasize enough that the quality of documentation is absolutely critical to the timeline at which we can get federal reimbursement for these costs. So I'm going to go over the next few slides about exactly what documentation you need to be gathering for your organization to receive timely reimbursement. First, let's talk about labor costs. So this probably will be one of the largest costs that most organizations have as a result of this incident. So again, we have only been authorized for emergency work costs under this pandemic. And FEMA has some very specific rules about what labor is eligible under an emergency declaration, and specifically a Category B emergency. So this chart here, I think, explains it very, very well. But essentially, FEMA splits out all employees in between budgeted employees and unbudgeted employees. So really, stepping back from this and just taking a big picture view of this is if you have already budgeted for that employee, FEMA's never going to pay their straight time costs. And that's because they are in your budget, and those costs need to be, paid by you just like they would otherwise. The other type of employees are unbudgeted employees. There's kind of some examples here, but essentially, if they're on an external funding source, like they're grant funded, and those grant funds cannot pay for their response to this incident, and they're specifically, protecting public health and protecting and saving lives, those costs, both their straight time and overtime, will be eligible if they are an unbudgeted employee. However, if they are a budgeted employee, the only costs that are going to be eligible is their overtime costs. So again, on whatever timesheets or time tracking that you are using for this, and we'll go over kind of what forms are required in a little bit, make sure that you're identifying whether this person is a budgeted employee or an unbudgeted employee. And if they are an unbudgeted employee, expect that there will be questions from FEMA about what their normal funding source is, and if they were a contractor or a temporary employee that was hired on specifically for this event, there will be, documentation requirements surrounding, that hiring and, why they were brought on as an unbudgeted employee. So, moving on to labor cost documentation. So, all of these things are going to be required for FEMA reimbursement. So, first and foremost are signed timesheets. So, when we say signed timesheets, we really mean some sort of document that is signed by both the employee and their supervisor or somebody above them that say, yep, these were the hours that they worked. Electronic signatures are usually fine. A lot of, time tracking software, Chronos, et cetera, is going to be acceptable. However, expect that the signed timesheets are absolutely necessary documentation. The next thing is an activity log that provides details that describe the specific tasks and accomplishments really on like an hour to hour, half day to half day, or day to day basis, depending on, kind of what tasks were accomplished. A timesheet is simply not enough for FEMA reimbursement. We really do need an activity log. Um, One of the best ones that is widely available is called the ICS 214. That's Incident Command System 214 form. It has all the information that we generally do need on those activity logs. But again, I just need to emphasize that just having a timesheet and having somebody say, "Yep, I was here today and I was, working on eligible activities," that's not going to be enough to support reimbursement. They really do need to have an activity tracker showing their tasks and their accomplishments and how they relate to the emergency protective measures of the COVID-19 pandemic. Additionally, we will need their payroll information, obviously, their rate of pay. And then down here at the bottom, also we need their fringe benefit rates and your policies surrounding how those fringe benefit rates are calculated. But we do need their payroll information. We need to know how much you're paying them because this grant is a cost reimbursement. The next thing that we will need is payroll records or check records, basically showing that those employees were paid. Think of it as proof of payment, which we'll get into a little bit later for contractors. And then we'll also need your payroll policies and your overtime policies, just to make sure that again we're complying with your locally adopted payroll policies and overtime policies. A big question that we usually get is, well, what does FEMA consider overtime? And the answer is it depends on what your policy is. So whether overtime is more than 10 hours in any given day, more than 12 hours in any given day, more than 40 hours in a week, or if it's some sort of modified schedule, that often law enforcement officers or firefighters will use. Whatever your overtime policy is what FEMA is going to use as the policy that controls how much you are eligible for reimbursement, which again is why providing your payroll policies and your overtime policies is a requirement. The next thing I wanted to cover is how to properly document the use of equipment. So equipment logs are required for every piece of equipment that you are claiming reimbursement on. The key thing about the equipment logs is it actually does need to show the number of hours that the equipment is being used, not just, it was on the site for 8 hours and we're claiming all 8 hours. That's usually a pretty big red flag for FEMA that what they're getting is not the actual equipment hours for use. FEMA cannot pay for standby time for equipment, and so it's really important that we actually have detailed logs that show when the equipment was being used. The other side of the coin is if you are using equipment, say, a truck or something, just for transportation purposes, you need to claim the mileage on it instead, and that will be reimbursed at just the normal GSA rate. Similarly, police cruisers have two different rates. So when they're being used as traffic control or as some sort of barricade, and they need to be running, there's actually an equipment rate for them. However, if they're just being used for transportation purposes and being driven around the community, then you would claim the mileage rate. That's kind of the way to think about whether you need an equipment log or a mileage rate. Additionally, it is extremely important that all equipment must be tied to an operator. If the backhoe is being used for 5 hours and that person has 8 hours on their timesheet, that's going to be fine. Conversely, if the backhoe is being used for 8 hours but the operator only has 5 hours on their timesheets, that's going to lead to questions. But an operator is required to be shown for every piece of equipment that needs an operator. Obviously, there are pieces of equipment that don't need operators, such as lights or generators would be another good example of pieces of equipment that do not need operators. However, if the equipment does need an operator, it is required to show that documentation. The next type of eligible cost are contract expenses. So if you are entering into contracts, there's quite a few rules surrounding these, but I'm just going to talk about kind of the documentation that is needed first and foremost. So obviously we will need any invoices related to these contract expenses. We will need to see the actual contract itself. We'll also need to see any amendments, any change orders, or any task orders to that contract. It all needs to be in there together. Additionally, we will need to see proof of payment. And then finally, we will need to see the procurement documentation on these expenses. So moving on to talk a little bit about procurement. FEMA does have a memo on their website, and it is going to be on the DHSEM website. Essentially, what this memo says is really three things to kind of start out with. So first and foremost, all costs have to be demonstrated to be reasonable. We could probably have, an hour-long conversation on just documenting cost reasonableness, and we don't have the time for that today. However, there is a really good document on FEMA's website, and here is the web link to get to it. But look up the reasonable cost job aid, and it's about a 10-page document that really helps with documenting that you got a reasonable price. Again, I cannot emphasize this enough. This is required documentation when you have a contract expense. If you do not have something that demonstrates that the costs are reasonable, your reimbursement will be rejected until you get something that demonstrates that the costs are reasonable. The next thing that is really important to document is that the costs are necessary. So, as we are working under emergency and exigent circumstances right now, it's easy to overlook this, and it's easy to just say, well, my emergency manager told me to do it. What we do need to do is stop for a second and really, justify why it is that we are purchasing these goods or these services. And it doesn't have to be anything big. It can be two sentences that somebody sends in an email to just document the decision making process. It is so much harder to go back a year from now or even 2 months from now and document why you made the decision that you did. And obviously, the other thing to keep in mind is that hindsight is 2020. Something that you're purchasing today may not seem necessary 3 months from now, just due to the nature of what we are dealing with right now. So take a few minutes, document why those costs are necessary right now, because in 2 or 3 months, they may not seem necessary and they may not seem reasonable. So that's why it's really important to document this stuff as it is happening. The next thing that we need to cover is just the local policies were followed, even if those policies are waived, and all of that supporting documentation needs to be there. So an example would be is if your local procurement policy says, the Board of County Commissioners can decide to waive county procurement policies, in the case of an emergency. Just point to that section and then provide the supporting documentation that the Board of County Commissioners actually did waive your local procurement policies. Again, down here at the bottom of the page, there is a really good fact sheet that FEMA put out specific for this event, and it covers everything that I'm talking about here in greater detail. I would absolutely recommend that every one of you take the time to read this fact sheet at the bottom, and then also the reasonable cost job aid that you can find in a link near the top of this slide. Next, I wanted to kind of just talk about the structure of the contract. So if you are entering into contract expenses, there are rules about what contracts are allowable and how they should be structured. So first and foremost, time and material contracts are highly discouraged by FEMA. In fact, they will be determined to be ineligible unless the following conditions are met. So first and foremost, you need to document that no other contract type was suitable, that the contract has a ceiling price that the contractor exceeds at their own risk, and we need to be able to demonstrate that the non-state entity provided a very high degree of oversight to obtain reasonable assurance that the contractor used efficient methods and effective cost controls. So I'll kind of go back and talk a little bit about each of these points, but first and foremost, just so that we're all on the same page, a time and material contract is where you agree to pay the contract a set rate for their time and any materials that they use. The reason these contracts are highly discouraged is that it generally puts all of the risk back onto the contracting agency and not onto the contractor. There's really no incentive in place for the contractor to control costs. That's why these are highly discouraged. So to go back through these, so you do have to make the determination that no other contract is suitable. So another type of contract could be a lump sum contract or a unit price contract. Both of those give more incentive to the contractor to control costs. The other really key point here, bullet point number 2, is that the contract has a ceiling price that the contractor exceeds at their own risk. So essentially what this means is, if you execute a contract for $200,000 on a time and materials basis, and the contractor just keeps working and they go over that $200,000, it needs to be very clear that they did that at their own risk and that you are not liable for those costs in any way. If that happens and you just do a change order to allow those costs, then you violated this second bullet point here. This is not to say that you cannot do change orders and increase the amount in a time and materials contract. However, it needs to be a negotiation and it needs to be something that you are agreeing to prior to the contractor going over that ceiling price that you have set. And then finally, the last bullet point here, really what this last bullet point means is that if you are entering into a time and materials contract, you need to have really robust contract controls in place and really robust contract management practices. So an example of this would be daily work logs are required and somebody on your team is actually reviewing them and making sure that the contractors are spending a reasonable amount of time on the tasks that they are accomplishing. Obviously this can vary by the different things, but if you ask a contractor to, type up a memo and they spend 20 hours typing up a one-page memo, that's not reasonable. And we need to show that we are being good stewards of taxpayer money by putting some really strict requirements as far as daily work logs and contract oversight on a time and materials contract. Again, these types of contracts are highly, highly discouraged, but sometimes they are the only type of contract that works for some of these circumstances. The next thing I wanted to talk about with contracting is that cost plus percentage of contracts are always going to be ineligible. So again, just to kind of make sure that we're on the same page with what this means is anytime the contract structure is such that the contractor will be reimbursed for their costs and then they get to tack on a percentage profit or a percentage of overhead or anything along those lines, it's generally a big red flag, and FEMA is going to mark those as ineligible contracts. That's just in 2 CFR, the federal rules and regulations. So do not ever enter into a contract that the contractor's profit is in any way tied to their costs. Obviously, the thing that we're trying to avoid here is having the contractor run up their costs so that they can increase their profits. That's why those are disallowed. Also, piggyback contracting is generally ineligible. And what we mean by piggyback contracting is when one jurisdiction allows another jurisdiction to use their contract. That's what a piggyback contract is. If you want to utilize a contract that another jurisdiction is using, enter into a new contract with that vendor using similar terms and conditions, again, provided that that's okay with your local procurement policies. But do not use the same contract. That's a piggyback contract, and generally those are ineligible. Additionally, any contract that is for over $10,000 must include clauses for termination, both for cause and for convenience. And those clauses you can readily find just by Googling termination for cause and for convenience. Those will also be available on the DHSEM website. Finally, any contract that is over the simplified acquisition threshold of $250,000 must include all federal provisions listed in 2 CFR Part 200 Appendix 2. So there's quite a few different provisions that are required in all contracts that have federal reimbursement. Again, they can be found at 2 CFR Part 200 Appendix 2, but we will also have kind of sample language on the DHSEM website available. All right, the next thing I wanted to talk about is donated resources. While donated resources are not an eligible cost in and of themselves, they can be used to offset the non-federal share of your award. So currently, the Major Disaster Declaration, DR 4498, has a 75% federal share and a 25% non-federal share. You can reduce that non-federal share by documenting your donated resources. So to have a donated resource be eligible, first and foremost, it must be either labor, equipment, or materials. And then these bullet points here all apply. So first, the donated resource must be from a third party. And third party do include individuals that could be, if you're a county and a county employee wants to volunteer on their weekends, that's actually probably going to be a eligible donation. But it has to be that they're being unpaid. Obviously that's the whole point of them being donated. The donated resource does have to be a necessary and reasonable expense. So again, we're working with emergency protective measures, so they have to be donating something that does help protect public health or save lives. The next bullet point here is that the applicant must use that resource in the performance of eligible work and in the project's period of performance. And then finally, the applicant or volunteer organization must track the resources, the work being performed. You must include a description, the specific location, and the specific hours that those donated resources are being utilized. If you are able to document your donated resources, it is a very good way for the state to increase our federal reimbursement under this disaster.